Good morning, everybody, and welcome to this Leadership Perspectives, the Case for Gender Equality in Health event. I'm Tom Simonson. I'm the CEO of the Victorian Healthcare Association, and for those of you who don't know us, we're the peak body supporting Victoria's public and community health services to deliver high quality, excellent, safe care to the Victorian community. I'd like to acknowledge the traditional custodians of the land that I live and currently work on, which is the Dja Dja Wurrung people, and recognise their continuing connection to the land and waterways. And I would also like to pay my respects to their elders past, present and emerging, and extend this to all Aboriginal and Torres Strait Islander people who may be with us here today. In the context of gender equality, I think it's also important to acknowledge the work of the many women, members of the LGBTIQA+ community, and particularly First Nations women, who have been tirelessly campaigning for gender equality for many decades. Without their effort and dedication, undoubtedly, we would not be here today talking about this subject. So it gives me great pleasure to welcome you all today. Firstly, just a little bit of housekeeping. We will move shortly to our panel. Dr. Sue Matthews, CEO of the Royal Women's Hospital, Dr. Niki Vincent, Public Sector Gender Equality Commissioner, and Chris McLoughlin, the Executive Director of People and Culture at Alfred Health, and I will introduce them in a little bit more detail in a moment. But once they have spoken, we will then be inviting you to submit your questions to be answered by the panel. So we'd ask you to do that through the Q&A function, which you'll see at the bottom of your screen, and we will be putting as many of those questions as possible to the panelists. Julia Portelli and Joanna Hatcher from the VHA will be moderating the Q&A and general comments in the chat. We've got automatic live transcription enabled for the event. It's automatic, so if something comes up that doesn't seem to make sense, that may be because it doesn't make sense. Please let us know in the chat and we can clarify. And we are recording this event, and a link to the recording will be available after the session. We know everybody in the health system right now is incredibly under pressure, and so there will be some people who will see this for the first time via the recording, and so we're providing that for that reason. I'd also like to invite you all to follow us on Twitter, which is @VicHealthAsoc, and join the conversation today by using the hashtag Women's Health Week, because we are, of course, in Women's Health Week. Finally, and just to be really clear and upfront, there may be some things that come up in this conversation that may be challenging or may trigger people who are listening. If that is the case for you, please, I encourage you to call 1-800-RESPECT, which is 1-800-737-732 for any support that you might need. So, as you will all be aware, in early 2020, the Gender Equality Act was passed through the Victorian Parliament. This act is the first and so far only legislation in Australia that requires public sector organisations to make progress towards improving gender equality. So that was an incredibly exciting but quite brave change in Victoria. We are known, obviously, as a state that takes first steps in a number of areas that are challenging. I have to say this one probably shouldn't be as challenging as it seemed, but it clearly still is, and that is why we're having this conversation today. So we as an organisation strongly support the intent of the Act, and we've worked closely with our members and the Victorian Health Organisation Gender Equity Network, which is VHOGEN, to help health services share best practice and successfully implement the Act. We've also worked very closely, obviously, with the organisations that are here today, and thanks to Sue and her team at the Royal Women's for first suggesting the event, and thanks for Chris, the Alfred. The Alfred have been a very active member of VHOGEN, and absolutely thank you very much to Niki for all of your support for the sector in implementing the requirements of the Act. So we know that gender inequality exists everywhere. It exists in our schools, in our workplaces, in our neighbourhoods, in media and in sport. And I have to say it was extremely confronting for me to be reminded just yesterday that obviously the situation in Afghanistan, one of the first things that has changed is that women's sport has been banned. So, you know, to say that we are We are making progress in gender equality is absolutely true, but to say that there is a long way to go here and around the world is also absolutely true. It means that women, men, and gender diverse Victorians can often not reach their full potential. And we know that the health impacts of gender inequality, such as family violence, poor mental health, social exclusion, and poverty, continue to be extremely significant. We also know that gender inequality has been hugely compounded by the pandemic. You will have seen recently that the gender pay gap, which had been getting better for a number of years, has got worse, largely because of the impacts on women of the pandemic and what that has done to the employment market. Finally, we know that leadership within organisations is critical to the success of the Act and gender equality more broadly. So our speakers today will provide you with insights into how you, as leaders within your organisations, can champion change and how this will benefit the communities you serve, your staff, and improve performance, productivity, and most importantly, culture of your organisations. So first off, I'd like to introduce Dr. Sue Matthews. Sue is the CEO of the Royal Women's Hospital and will be known to many of the people on this call in that role. She's an experienced health service leader with more than 20 years of senior operational and strategic leadership in hospitals, community care and government, both here in Australia and, you will guess from her accent, in Canada. She sits on a number of boards and advisory committees, and she's won numerous awards, including one of Canada's top 100 most powerful women and the Canadian Nurses Association Centennial Award. Most recently, the Royal Women's Hospital was awarded the Victorian Premier's Health Service of the Year in 2016. She's also, very proud to say, the chair of the VHA's board, and she is going to open our proceedings, and I will pass over to you, Sue.
Thanks so much, Tom. Good morning, everyone. I too would like to begin by acknowledging that we are meeting on the lands, for me, the Wurundjeri and Boonwurrung people of the Kulin Nations. I pay my respect to elders past and present, as well as to elders and community members from other areas who may be with us today. I would also like to welcome Dr. Niki, Vincent, and Chris McLoughlin as we consider the importance of gender equality for the health and well-being of women in our workforce and as our patients. So this is a really important discussion during Women's Health Week, and as Australia's first and largest specialist hospital dedicated to improving the health of all women and newborns, every week for us is Women's Health Week. But I also acknowledge the importance for us as health services to stop and take some time to reflect on the health impact of gender equality and consider what we can do to address this. So for more than 160 years, the Women's has been advocating for new approaches to women's health, as we've always recognized the different health challenges that women face across their lifespan. Our practice has changed over the decades, but as a service whose values are courage, passion, discovery, and respect, we know that there are benefits in continuous reflection and improvement. And it's hard to step back during a pandemic to take some time to reflect, but we need to be innovative and responsive to changes in our community's expectations and to the health and well-being needs of our patients and our staff, particularly right now. Generally, the health system overall disadvantages women. It's a system that is built by men, for men, and there are many examples of this, starting with clinical trials and the fact that most of them are done on men and even use only male mice. So whether it's testing the effects of obesity on breast and uterine cancer using only male studies, really happened, or testing the safety of female Viagra when taken with alcohol in a study that used 23 men and 2 women. Both of those really happened. The healthcare sector is full of examples of gender inequality. Gender also affects the way that we prioritize medical conditions. So women are less likely to have their pain treated, and they're more likely to be prescribed sedatives than men to treat pain. Women who have a coronary bypass are half as likely to be prescribed pain relief compared to men who've had the same surgery. And I could go on forever about these inequalities. But the pandemic has highlighted the inequalities. It's been a difficult 18 months, and the impact of this pandemic has not been felt equally across our community, and as Tom said, or across our hospitals. We realized quickly last year that the inequities that already existed in society were being heightened by this pandemic. Family violence, economic security, mental health, sexual and reproductive health are all health and well-being issues where women have been disproportionately affected. Thinking about health specifically, women are significantly more likely than men to have experienced negative mental ill health, leading to a substantial increase in demand for mental health support among women in the general community. Mental health services in Victoria have reported a significant increase in women presenting with serious mental health issues during COVID-19, and that includes severe anxiety and depression. In terms of sexual and reproductive health, we've also seen an impact on women, including an increase in anxiety around pregnancy and birthing, difficulties for women in rural and regional areas in accessing abortion services, and an increased risk of reproductive coercion. Sometimes called the shadow pandemic, the impact of lockdowns in particular has been felt by women. There's been an increase in reporting of family violence and sexual assault. The impact of this increase is borne by our patients, but it's also borne by our staff, both as caregivers, but also as victim survivors themselves. So a recent research study done by some staff of ours at the Women's found that 45.2% of female health professionals reported violence by a partner and or family member during their lifetime, and 12.8% reported both. The evidence tells us that violence against women, including family violence and sexual assault, is driven by gender inequality. The work we're doing now to promote and embed gender equality is precisely the work that we need to do to prevent such violence. And as we do this prevention work, it's imperative that we also respond safely and respectfully to victims, which all Victorian hospitals do through the Strengthening Hospitals' Responses to Family Violence and Workplace Support Programs, and for some of us through our Centres Against Sexual Assault, and for the Women's, the Sexual Assault Crisis Line that we run for the state. This important legislation supports us to do this critically important work of preventing gendered violence, because healthcare traditionally is about dealing with someone who has experienced violence, not preventing it. So we need to do this by addressing the specific forms of inequality that we know drive violence against women. So first is the work to promote women's independence and decision-making, which we'll be doing through our Gender Equality Action Plan. And that focuses on workforce changes to promote the status of women, such as reducing the gender pay gap. I'm always fascinated to know that in a sector with an 80% female workforce, there's such a significant pay gap. The UK found a 24.4% gender pay gap for hospital doctors, which means that the average pay of all female hospital doctors is 24.4% lower than that of male hospital doctors. Australian data pre-pandemic showed that in healthcare, the gap is about 20.7%. An American study that found that this gap is widening during the pandemic, as Tom alluded to, and it's now as high as 28%. Dr. Linda Brubaker, who's a professor of obstetrics and gynecology and reproductive services in San Diego in the US, pointed to systemic assumptions that only widen the pay gap and said, women physicians do not have trouble balancing competing demands any more than men physicians do. It's simply a more common expectation that women physicians will adjust their professional lives. But that's just doctors. Systemically, one of the main causes of a gender pay gap in healthcare is that female-dominated industries and jobs attract lower wages. So nurses, midwives, aged care workers, and others have lower wages from the start, and that reflects the lower social and financial value given to the traditionally female jobs. And these are often seen as a calling rather than a career. And that would say that you don't deserve the amount of money as a recompense than you would if it was seen as a career. So this leads to the second piece of prevention work, and that's challenging those rigid and harmful gender stereotypes and roles, which the Act also considers when it asks us to look at gender segregation in our workforces and in flexible work. Another program supported by the Victorian government that supports hospitals to challenge the stereotypes but is consumer focused is the Baby Makes 3 initiative. And it's a primary prevention program that seeks to prevent violence before it occurs by promoting equal and respectful relationships between men and women during the transition to parenthood. And it's recently been reviewed and revised to be more responsive to and inclusive of LGBTIQ and Aboriginal persons and their families. The third piece of work to prevent violence is to strengthen positive, equal, and respectful relationships. Now, most of us will have a respectful workplace behaviors program, and that's the way that we do this, particularly with a focus on sexual harassment, another gender equality indicator. So the final action is challenging the condoning of violence against women, and our Strengthening Hospitals Response to Family Violence and Workplace Support programs do this through their policies, procedures, and communications, and it sends a clear message that we do not condone family violence against our patients or against our staff. The Act's requirement that we report on family violence leave is a way that we can continue to be accountable to victims. The Act, whilst focusing on gender, also promotes us to consider other forms of discrimination that our staff and patients experience. Last year, many of us shifted to telehealth, which has been necessary to keep our staff and patients safe. As we made this shift, though, we also considered how such a change in service delivery might impact patients who are victim survivors of family violence, and particularly those who required a tailored response due to discrimination that they face or due to barriers in accessing support. So we should be questioning whether all of our patients should be given telehealth. If we think there's a risk for family violence, we want them to come in and be seen face to face. So we knew early on that some women were not in a safe place to talk about violence when they're on a call with a midwife or nurse or doctor. So we couldn't ask about family violence safety. For some patients, that technology was a barrier to communication, and it was due to unfamiliarity with the technology for some, language barriers, or access to the technology itself. So we needed to adapt how we were working with patients from different communities, even as we were making this shift. We need to ensure that there are appropriate opportunities for women to have face-to-face appointments so that family violence discussions can occur and support can be offered. We must advocate for this to those who want more and more efficiency in the system, moving to more and more telehealth. We need more research to understand how this may impact women. The gender impact assessments that the Act requires will prompt us to do just this, to ask not just how people from different genders will be affected by service changes, but which women may be less safe or may not be able to access the necessary care if we don't take an intersectional approach and tailor how we engage with them. I'm excited about what we can achieve through this work. The Act presents many opportunities as well as a few challenges, given the size of many of our workforces, the breadth of the work of public hospitals in particular, and the extent to which our programs and services have a direct and significant impact on the public. Doing this in a global pandemic will be one of the biggest challenges. And Niki, I did hear a collective sigh of relief on the first day of spring when the Gender Equality Action Plan extension was announced. What these extra months will allow us to do is to take a bit more time to consult with our staff and consumers about the approach with this work. Our approach is to locate our gender equality initiatives within the next Prevention of Violence Against Women strategy, with a vision of a safe and equal community free from violence. Situating this work within a prevention strategy allows us to clearly communicate how we have considered the principles within the Act, those specific ones, that gender equality is a human right and a precondition to social justice, that all Victorians should live in a safe and equal society, have access to equal power, resources and opportunities, and be treated with dignity, respect, and fairness. And finally, that gender equality brings significant economic, social, and health benefits for Victoria. Many people have talked about this pandemic disproportionately affecting women. And when we look at the recovery of this pandemic, it's focused particularly on those professions that are men. So as we look at big builds and et cetera, those are things that need to happen, and it will give an economic benefit. But we also need to see things that will be directly affecting women and improving their social and economic status. So through this framing, we can also bring together gender equality initiatives with our response work within a whole of hospital approach. As statewide family violence leads a prevention approach makes sense, as prevention work is complementary to the Strengthening Hospitals response programs, to our Centers Against Sexual Assault and our Sexual Assault Crisis Line, our abortion and contraception leadership work, and the various initiatives that are arising through our Reconciliation Action Plan and Disability Action Plan. I understand that many other services may be locating this work within their diversity and inclusion or equity frameworks, plans, or strategies, which is an equally sensible way to progress initiatives that address inequality and view equality as a human right. It's important that we keep working to end violence against women for the health of our staff and our patients. In such busy times, it's easy to forget that the top risk factor in relation to the burden of disease for women aged 18 to 44 is intimate partner violence. For Indigenous women, that burden is 6.3 times higher than for non-Indigenous women. It's also greater for women with disability and for women from some culturally and linguistically diverse communities, or those experiencing social and economic marginalization. Notwithstanding the great resourcing and focus on family violence over the past few years, family violence is still very much a health and well-being issue for many women. As health providers, we need not only to continue to have safe and supportive responses and pathways out of violence, but to start playing a greater role in preventing violence before it occurs. Every interaction within our service with a colleague or patient or family member is an opportunity to promote respectful relationships, and through the gender impact assessments of our gender equality action plans, we can remedy those inequalities that exist for people of all genders, regardless of where they come from, how they identify, or their social status. I look forward to doing this work with many of you, and also to hearing from the other two panelists, Niki and Chris, about the business case for their work and how the Alfred is supporting this work. Thank you.
Thank you so much, Sue. And when you opened your comments, and I was reminded, I was taken back about 9 years to the first time I ever visited the Royal Women's as a member of VHA staff, and your predecessor as CEO sat me down and told me about the difference between, I know this sounds very obvious now, but the difference between female and male physiology and the way that drug trials operate, and the huge disproportionate amount of men who are involved in medical research and trials, and the male mice and all of that kind of, and at that point it hit me like a sucker punch, because I'd grown up in a world where I thought equality was kind of everywhere. You know, that was my particular experience, and I had not been confronted by that fact. So thank you for your comments, but yeah, just my reflection that incredibly powerful, but very important, and we need to keep reinforcing all of the things that you said. I'd now like to introduce the Commissioner for Gender Equality in the Public Sector, Dr. Niki Vincent. As Commissioner, Dr. Vincent is responsible for overseeing implementation of the Gender Equality Act, and plays a key leadership role in promoting gender equality in the Victorian community and in Victorian workplaces. Dr. Vincent most recently served as the South Australian Commissioner for Equal Opportunity, in which she was responsible for the general administration of the South Australian Equal Opportunity Act. During that time, Niki chaired the Australian Council of Human Rights Authorities, served on the National Management Committee of Play by the Rules, and was a member of the South Australia and Northern Territory Advisory Council for the Committee for Economic Development in Australia, because we like a long title with a longer acronym. Niki's past engagements span across a number of other domains, including CEO of the Leaders Institute of South Australia, member of the Remuneration Tribunal of South Australia, and establishing 2 successful not-for-profit organisations. Mother of 4 children, Niki has also been a weekend respite foster mum for almost 5 years. Niki, can you tell us more about the business case for gender equality in the health sector, and how health services benefit from gender equality in their organisations?
I certainly can, Tom. Thanks very much for that introduction. And Sue, what a fantastic talk. Yep, I could pretty much leave it to you, I think. I don't think we need to talk anymore. It was just astounding. So thank you. But before I start, I do want to also acknowledge the traditional owners of the land on which I'm coming to you today, the Boonwurrung people of the Southeastern Kulin Nation, and pay my respects to elders past, present and emerging, and any Aboriginal leaders of other communities who might be here today. So as you know, Gender Equality Act came into effect on the 31st of March this year and requires public sector organisations across the board in Victoria, and including all of the universities and all of local government, to collect data, develop plans and report on their progress towards gender equality in their workplaces. Beyond the workplace, as Sue said, the Gender Equality Act requires organisations to think about and look at how their public policies, their programs, their services impact people of different genders to ensure they don't unintentionally reinforce or create inequalities. And there were some fantastic examples that Sue gave of where that hasn't been done and the impacts that that has. And there's a book full of those in my favourite book, which is Invisible Women by Caroline Criado Perez. So if you haven't read it, definitely read it, but be prepared to be shocked and be prepared to be angry at the history of this. So why do we need the Act? For all the reasons that Sue mentioned, because it means that we are working towards gender equality, which means that people of all genders have equal rights, equal responsibilities and equal opportunities, whether they're women, men, trans, gender diverse, intersex, and so on. And we all want to see that. When we ask that question, there's almost no one that doesn't think that's the right thing to do. But far too many people still find their opportunities in life are limited by outdated ideas about gender. And whether it's the gender pay gap that devalues the work of women, nationally, women, as we know, after Equal Pay Day last week, women need to work an extra 61 days on average to earn the same as men in Australia. And whether it's an underrepresentation of women in leadership. And even when we do have women in leadership, the pay gap still persists. In fact, the Workplace Gender Equality Agency's data shows it gets worse the higher up the ranks women go. And even in female-dominated industries, there's an underrepresentation of women in leadership. Or whether it's the prevalence of sexual harassment, and we know this is something that exists in so many workplaces, and we've heard another example of that only earlier this week, horrific examples in Victoria. So we've still got a long way to go to achieve gender equality. And in fact, the global gender pay gap has widened over the past 12 months, with the World Economic Forum finding that based on the current pace of change, or organic change really, it's now going to take 135.6 years to close the gender pay gap worldwide. And I can't tell you how astounding that is after all of our efforts. And I'm really excited to be leading the Gender Equality Act's implementation in Victoria, because I don't want to wait that long. I don't know about you, I'm sure you don't either. Also, as Sue mentioned, the gendered impacts, economic impacts of COVID-19 have contributed to this backward slide, emphasising the importance of not taking our foot off the accelerator now, the importance of gender-sensitive responses as we recover from COVID-19. At an organisational level, this is a time where more than ever we should be building inclusive workplaces, supporting equal representation in leadership positions, and providing leave and flexibility for those with caring responsibilities. Flexible working conditions can be a critical factor in attracting top talent in all industries. Evidence suggests that all employees, including the young, the senior, and employees with family responsibilities, young men as well, are all more likely to be engaged and motivated in workplaces with access to flexible working arrangements. And beyond the moral imperative, there's an economic imperative to achieve gender equality. Research indicates that improved gender equality brings significant cost savings for employers, including reduced absenteeism, increased productivity and profitability in the workforce, and increased employee engagement. A recent McKinsey study of 1,000 organisations across 12 countries found that companies that had taken steps to improve gender equality were more profitable than national averages. And those with gender diversity on their executive teams were more competitive and more likely to have higher profits. The Harvard Business Review found that having more women in leadership increases retention of women in more junior positions, as they can see that career progression is possible for them. And when more women are in leadership, sexual harassment also decreases, as diversity in leadership helps to improve the workplace culture. Research earlier this year by McKinsey and leanin.org found that in the US, juggling work and caring responsibilities during COVID-19 has massively negatively impacted women's workforce participation. More than 1 in 4 women were considering taking a back step at work, or even leaving the workforce completely. They just couldn't do it all, as we can't do it all regardless of COVID. And certainly with COVID, that's just become such a salient issue. The potential loss of talent is significant, but as countless evidence shows, leave provisions and flexible working arrangements can support retention. So what's the benefit of gender impact assessments? Well, I think Sue has talked up the benefits so well, but we all want the programs and the policies and services our organisations deliver to be of equal benefit to those who need them. However, without a gender lens on them, we can inadvertently find that they're impacting people of different genders in different ways, and we might then unintentionally create or reinforce existing inequalities. And there were so many examples that Sue gave of that happening in health and medical science and so forth. And there are so many other examples of that throughout all kind of areas of our community and throughout history. So beyond the fact that there's a moral and legal obligation here, again, we can also find that targeting inequality and creating more efficient and effective policies and programs and services will result in longer term cost savings. And you probably have heard that the gender impact assessment that was done by a municipality in Sweden, which changed the order in which it cleared snow from the streets, beginning instead with pedestrian streets and cycle lanes that were more likely to be used by women. And it not only did it remove a physical barrier for women, but it also reduced the number of accidents and therefore lowered the healthcare costs. Closer to home, as Sue mentioned, Baby Makes 3, Northern Health and Baby Makes 3 got together to look at Northern Health's childbirth and parenting education program and found that information about the program was addressed only to the birthing mother, which was based on a very outdated assumption that only the birthing mother would require the skills to care for a new baby. So the first change was just to amend the introductory letter, a very simple thing to include the partner or support person as well. And another finding from the gender impact assessment was a lack of inclusion for diverse families. So Northern Health focused on creating a welcoming environment that acknowledged diversity and provided more inclusive education materials and imagery and so forth. And this example, it's a small changes that make a big impact. It shows the importance of undertaking gender impact assessments in shaping our public-facing policies, programs and services. They provide a lens to examine our unconscious biases and our assumptions that might otherwise be overlooked or invisible. Where possible, as Sue also mentioned, it's important to consider intersectionality as a part of gender impact assessments, but also in terms of your internal gender audits as well. Intersectionality refers to those identity factors that make us each who we are. So not just our gender, but also race, ethnicity, sexual orientation, age, disability, and other factors. Our different identities can have a really important compounding effect on inequality. And so it's really important to consider intersectionality to ensure that services are appropriate and available for different people with different identities. For example, Breastscreen Victoria used a gender impact assessment approach to develop its policy for screening trans and gender diverse people. It conducted research, it surveyed trans and gender diverse Victorians and hosted a forum to inform the development of its inclusive services. And as a result, Breastscreen Victoria developed a policy for screening trans and gender diverse people, as well as education for its staff and tailored information for trans and gender diverse people, including recommendations for who should get breast and chest screenings and what to expect. This means that Breast Screen Victoria is providing a better service to the community. It's ensuring that people don't miss out on potentially life-saving screenings. So these small examples show how gender impact assessments can shape public health offerings for the benefit of the community. And I'm genuinely looking forward to hearing many more positive stories, like Sue mentioned, as organisations begin implementing recommendations from gender impact assessments. And if you already have some great examples, we'd love to hear about them, because we're sharing examples on our website so that others can learn from them. So I argue that it's even more important than ever that we work to address gender inequality, or we risk going even further backwards. Just as COVID-19 has exacerbated existing inequalities, I also want to acknowledge that it's continuing to create uncertainty and constraints in many organisations, and none more so than the health sector. Given these exceptional circumstances and the uncertainty about ongoing impacts, I have, as Sue said, provided the option for a two-stage submission of gender equality action plans to alleviate the pressure on organisations and individuals. And under this two-stage option, organisations will need to still submit their gender audit data by the 1st of December, and then they'll have until 31st of March to work on their gender equality action plans through their consultation process. And they will then submit the rest of their gender equality action plan to me on the 31st of March. And so I want to be clear that this is not about deprioritising gender, and I'm sure that you know that, but instead ensuring that you have adequate time to undertake the meaningful consultation that you need to do, and then submit a higher quality plan that will set you up to make real progress. Having said that, I also have to say, just do the best you can given the circumstances. Gender equality isn't a nice to have anymore. The Act says it's a must have, and it really reflects the priorities of our community. And so I'd encourage you as leaders in your organisations to try and, rather than seeing gender equality as an add-on, think about how you can be asking questions that just make it a holistic, business as usual part of your work. But applying a gender lens should be a business as usual, should be standard, embedding it in policy program and service design from the very beginning. And I would suggest it should be included as a standing item in all of your board meetings, on your agendas, just as you would do for work health and safety. This provides ongoing visibility of the progress being made or any issues becoming apparent, rather than waiting until it's time to report to me. And it keeps the conversation going about gender equality. And I also encourage you to stay in touch with the Commission, sign up to our mailing list if you haven't already. And for more discussion on the role of leaders, I'm speaking this Tuesday morning at a virtual event with the Australian Institute of Company Directors. I'm going to be joined by the Director of the Workplace Gender Equality Agency, Mary Waldridge, followed by a panel discussion on practical actions that board directors can take to ensure their organisation achieves its legislative obligations and beyond to promote gender equality. So I hope some of you might be able to join us there. Thanks again for inviting me to speak today, and I'll be very happy to answer questions a bit later on if we have some time. Thank you.
Thank you very much for that, Niki. And I would just like to add my thanks for the extension of the deadline, because really it allows us to do this work in the meaningful way it is intended, which of course during COVID is something of an active challenge, but it's about making sure that that work is as meaningful as possible. So thank you very much for that. We'll now move to our last panelist, which is Chris McLoughlin, who's the Executive Director, People and Culture at Alfred Health. Chris has over 30 years of management experience and has been involved with public health specifically for the last decade, with her current role having a strong emphasis on organisational transformation. Chris co-chairs the Alfred Health Gender Equality Committee and is an executive sponsor for the Gender Equality Work. She's also a member of the Gippsland Southern Health Service Board, which is another VHA member. Chris, recognising that there'll be many people listening to this webinar, I'm mixing methods, that are new to this work. Can you share some of the things that Alfred Health has been doing over the last 12 years to drive change in this space?
Thank you, Tom. And over the last 12 months, I'm happy to share what we have been doing. We certainly can't wait 135 years, can we, Niki? So thank you both to Sue and Niki for your comments. I'd also like to welcome everyone on this call and acknowledge the traditional owners of the lands that we're meeting on today and pay my respects to elders past, present and emerging. I think everyone here would agree that the case for gender equality is a really compelling one, and thank you to the Victorian Healthcare Association for sponsoring this event. Pleased to contribute to the conversation some of the learnings at Alfred Health over the last 12 months. The statistics really tell a very clear story, in particular about the impact that COVID has had on women, and as reinforcing that in fact the pay gap in our sector is at 20.7%, which is very unacceptable. And I think I'd say that I'm sure that each of the health services joining this call will be at different stages along the journey. And while we're guided by the gender equality indicators within the legislation, I'm sure we each have priorities that are specific to our own organisations. Since the beginning of 2020, we've seen a cultural shift in favour of flexible work, which really could prove to be a silver lining of the pandemic. For Alfred Health, we're exploring this change and trying to understand its impact on women as a key focus. In 2020, we surveyed 850 Alfred Health non-clinical staff, 35% of whom said they'd worked from home consistently since the pandemic began. And there are several studies, including from the Australian Institute of Family Studies, which show that productivity engagement can increase during remote work. However, our 2021 PMS results, People Matter Survey results, indicate that almost half of our workforce perceive flexible work arrangements or carer responsibilities to be a potential barrier to success. So we have a lot of work to do here. Through our Gender Equality Action Plan, our focus will be on improving the experience of, one of our focuses on improving the experience of staff returning from parental leave. 73% of the workforce are women at Alfred Health and 36% are aged between 25 to 34, with around 9% on parental leave at any one point in time. That actually doesn't include those preparing for and returning from leave. So creating positive return to work experiences is crucial to retaining and attracting staff, especially important in skills shortages and the fact that our workforce is very dominated by females. We really must make significant change here to ensure that we retain our highly skilled workers, but we do know that resignation rates actually increase on return from parental leave, and particularly at the manager level. So as well as supporting the financial well-being of women, if we focus on improving the experience of parental leave, we'll reduce the cost of recruitment and training. We also know from the recent Deloitte Global Millennial Survey that flexibility and adaptability is one of the most important characteristics for a business, especially for millennials and Gen Z in choosing a career. We need to think more about how the health sector can embrace flexible work in the long term for both clinical and non-clinical roles. The world of work has changed, and without embracing this change, we'll fail to attract younger generations to our workforce, and we will lose these highly skilled workers and lose talent from our leadership pipelines. For Alfred Health, we're embracing this legislation and its potential for change, and it has been a big focus for us over the last 12 months. The Gender Equality Act is an excellent framework to guide us forward, and as leaders, we have an opportunity to take tangible steps. I'd like to talk about just 3 elements of our focus over the last 12 months. First is around collaboration. There are many opportunities to strengthen the ways in which we work together to build momentum towards our shared goals. Alfred Health is very proud to chair the VHOGEN Victorian Health Organisation Gender Equality Network, which brings together health entities implementing the legislation from across regional, rural and metropolitan health.
Attention all staff, Met Call 3 East Cardiothoracics. Attention all staff, Met Call 3 East Cardiothoracics.
A busy health service here, from you can tell from the overhead there. VHOGEN grew out of a need to support one another and a desire to advance equality across the health service. VHOGEN meetings and events such as this one create space for discussion, collaboration and shared problem solving. If you're not already in this network, I really encourage you to join it. Also recommend exploring collaboration opportunities within and across precinct groups. For example, this year we have activated the Alfred Research Alliance Gender Equality Network, which brings together professionals and advocates from 7 of our Research Alliance members. We meet quarterly to provide updates on gender equality within our organisations, share resources and plan collaborative activities. This coordination of the network is actually supported by a grant from Alfred Health. And I guess I would encourage all of you to consider how your foundations and philanthropic organisations could support gender equality actions. By connecting with one another through these networks, we can understand what actions are already underway, we can collaborate more closely on design and implementation, and we can develop workable solutions to common problems in our sector. Secondly, I'd like to talk about resources and investment. As you know, resourcing the implementation of the Gender Equality Act is mandated in the legislation. For Alfred Health, we also decided to resource the development phase of this work by bringing in a staffing resource to manage the project and embed specialist gender equality knowledge. Our project lead, who is Sarah Hill, brings enormous experience and expertise to her project lead role within the People and Culture team. And I know that many organisations on the call have also adopted a similar approach. This is an incredibly positive undertaking for us. Some of the returns on investment have been that we have the ability to drive this project independent of competing COVID priorities, which may be pulling staff in other directions. We have the space and the resource to engage our workforce and bring them along the journey. Being able to spend time on specialist tasks such as finessing the data audit classifications, which we would otherwise not have been able to do, and having the ability to support the sector by co-chairing VHOGEN and organising events such as this one. I encourage you all as leaders to consider how your organisation might best resource these projects. It's important that the organisational pressures of COVID, although they will continue, this work is essential. Thirdly, I'd encourage you to think about gender equality champions in your organisation. To drive cultural change in health, we need leaders who set the tone and operationalise the gender equality priorities. When leaders are engaged in this work, they have the opportunity to better understand the challenges and the barriers faced by female and gender diverse staff on the ground. Having a gender equality champion within your executive structure can also help other leaders become more aware of gender inequality through peer learning and awareness raising. If you haven't already done so, I encourage you to appoint someone on your executive team to be the project sponsor. For instance, at Alfred Health, we have project co-sponsors. On the executive committee, that's myself and Simone Alexander, who's the Chief Operating Officer. Together we chair the Interdisciplinary Gender Equality Governance Committee. Having such a committee ensures broad leadership engagement as well as compliance oversight. As an interdisciplinary focus, it's important because cultural change is not just about one person, one discipline, one department. It requires a whole of organisation approach. And finally, I'll just make some comments about bringing staff along this journey. Achieving gender equality requires all of us. Need strong leadership, but also grassroots action. And that's why we've been prioritising staff engagement, giving passionate staff advocates the opportunity to shape this work from the beginning. An additional positive of having a staff engagement and co-design strategy is that we do meet the consultation requirements under the Act. We're excited that once finalised, our Gender Equity AG will be a living document that will have a sense of real shared ownership. Some of the ways we've been engaging women at Alfred Health is in specific working groups, including Women in Leadership, Communications and Change, which have been facilitated by Sarah Hill. We've also dug deep into particular issues we've identified as priorities for improvement. For us, this includes improving the experience of staff returning from parental leave. To find out more about this issue, we've targeted effective staff to give us really honest feedback and practical ideas for improvement via a survey and interviews. The data collected is very compelling and tells a very specific story. Finally, we're working to harness existing staff initiatives such as localised department diversity groups and get them involved in this gender equality project, which in turn is supporting our intersectional lens. Hopefully, these handful of learnings will provide some ideas for you on ways forward The gender equality legislation is a catalyst for change for all of us. The work we're doing to progress gender equality is incredibly important. As Tom said in the beginning, leadership is critical to the success of this Act. Thank you, everyone, and good luck on your journeys. Thank you.
Thank you very much, Chris, for those really practical actions that you've been taking, and that anybody can pick up one or two of those things or all of the above and implement them in their settings, with support, of course, from VHOGEN and from the other services such as the Women's and the Alfred that are already extremely active in this space and have a lot of experience and are always willing to help. I know I'm not out of line in saying that. So we now have some time for questions. We have had a number asked, and I will try and get through as many as possible. We really do only have about 10 minutes though, so we'll try and get through them as quickly as possible. Now, the privilege of the first question goes to the person who asked a question all the way back at 10:04. So I think you get, Dilnaz, you get absolute first dibs. How do we encourage gender equality with cold women in our workforce, CALD, cold women in our workforce, where cultural and language barriers are prevalent? Can I maybe go to Sue first?
You can.
I put you on the spot.
Yeah, it's okay. I think there's a number of ways. I think the first thing is to have an action plan that relates to individuals from the CALD community. I think we need to assess what we're doing and ask a co-design with those individuals what our workforce will look like. And I think that's a part that is hard to do, but it's something that I think we have to really invest in. And it's about, that whole co-design and co-creation of things with the people that we care for and about and serve. So I would start with that.
Thanks, Sue. From an Alfred perspective, Chris, do you have any reflections with your workforce? And then I'll come to Vicky.
We think it's incredibly important to be part of our lens, and we do know from our data that actually, that there is increased disadvantage if you have multiple levels, and that's why the intersectionality lens is so critical. We're alert to it. It's on our agenda, and you'll see this reflected in our gender equity plan.
Thanks, Chris. Niki, what's your kind of view on this particular kind of part of the intersectionality discussion?
I don't have anything to add. I think what Chris and Sue said was absolutely spot on. We're all learning in this space as well, and we need to actually share our successes as well as where we could have improved things so that others can learn from them. So yes, I'm very grateful that they both articulated that beautifully.
The next question, it's around the gender pay gap, and the gender pay gap, I think, suffers from a view from a lot of people that it's actually a really easy problem. It's something that we know very simply how to solve. Why have we not just solved it? And the way that the question has been asked absolutely is the view we get from a lot of people. Why don't we just fix it? But if you've spent any time in dealing with the gender pay gap, it's an extraordinary, mind-blowingly complicated issue, and it comes from so many different directions, and it is very often not as simple as two people employed at the same time, one male, one female, same job, being paid a different amount. That does exist, but there are a whole bundle of other things. Do you want to just reflect, maybe Niki, I'll start with you, on what we can be doing tangibly about the pay gap in our organizations? Yeah,
sure. So you're absolutely right. It can be really complex, but it can be really simple as well. So there are some things that you could probably fix just by increasing the pay, where you find that people at the same level aren't paid equal amounts. And in fact, some organisations under the gender that are covered by the Gender Equality Act are considering doing just that. There's an example in South Australia of where the head of Treasury found that he had the worst pay gap in the South Australian public service, went back and fixed it immediately with a stroke of a pen, or a few strokes of the pen. He said he also had to fix it in other, the other way as well. So there were some men that weren't being paid the same as some women, but mostly it was in the direction of women not being paid as equally with men. So there are some pay gaps that can be fixed that way. But what I would stress is that if we don't fix the culture that allowed those pay gaps to happen in the first place, so the fact that we have unconscious bias in our recruitment, in what we see as leadership and merit, and how we promote and offer opportunities to women in organisations, those pay gaps will be back within no time. So you might fix it once and then have to fix it again and fix it again and fix it again. So you've actually got to work on the culture as well.
And Tom, can I add? Yeah, coming, I remember in Canada when we did pay equity, seems like a million years ago. I know Australia did the same thing. Nurses in hospitals were equated to pastry chefs, and it knocked everybody literally, saying this is absolutely ridiculous. And that was the basis from which we were building. And I think that it goes back to what Niki said. It's about culture, and it's about ensuring that we stand up and say that's not appropriate, that's not okay. And I think as healthcare professionals, part of that for us is about how we vote. And I won't tell you how to vote, but what I will tell you is that in Australia, 1 in 36 voters is a nurse or a midwife. That is powerful, powerful. And we need to actually action. And, if I had time, I would tell you a little story, but, about how my kids used to hate when they, politicians would knock on the door, and I would ask them, what were their, were they thinking about for me at the time, with the profession of nursing, and what were you going to do about it, et cetera. And I had two choices when they answered, and I could either like their answer and say, thank you, that's great. And if I didn't like their answer, two choices, I could tell, they could go away, or I could do what my kids absolutely hated, and I could invite them in. And that's what I did, and spend time educating them, sharing with them. Now you have to have the knowledge in and what you want to say prepared, but I think, as we head into election times in Australia, both from the Victorian and the federal perspective, we need to be thinking about that.
And I do think that one of the things we need to do is change the expectations that women have of their value as leaders. And that, we had a recent example here where reviewing a category of, seniors sort of in the corporate services area, that it was evident that some of the gender gap was evident and historical and surprising so it was bringing it to its attention. But I also know that one of the keys to changing this is coaching and supporting women to put themselves forward for roles ahead of when they think they're ready. And that we know about that one, that men think they're ready before they are, women think they're not ready a long way after they are. So putting women forward, coaching them, sponsoring them, supporting them is a real key to change.
And making sure that the whole management structure has that cultural foresight, so that people who do take that first chance, which can be very frightening, aren't sent burning in flames because actually the organizational culture wasn't the same as the culture of that team. And that's why it's so important to have that culture across the organization and not just within teams.
Can I add something as well?
Niki,
I think please. I'm just adding to Chris, like a lot of times women think they're not ready because they can't cope with the dual responsibilities of caring for families and so forth. So we've actually got to have other systems in place that allow women and men, in actual fact, to share the care and be flexible and so forth, because otherwise women can't do two jobs. They just can't.
Again, a silver lining of the pandemic is this, it is now present. It's actually okay to talk about family responsibilities, carer responsibilities, because people see them on the screen.
Yeah.
They see the kids homeschooling, they see the dogs, whatever it might be. So suddenly one of our senior leaders made that comment that, once talking about her teenage kids would have been seen as a barrier to her being the head of this unit. Now it's just assumed that you actually have a personal life, you have a family life, and all of that is, we're looking for some silver linings. That is one.
Yeah, it's great.
I absolutely agree with that. I just got my little text that tells me that we're almost out of time. I just did want to give a sense of some of the other questions, just so we know the areas we might need to continue to focus on. So people kind of asking about how much resourcing, what kind of amount does it cost to do some of the things that maybe you've suggested, Sue and Chris. I won't ask you to answer it now because we're out of time, but really it indicates that there is some work that we can do to help people understand tangibly how they can do more, and that's why I'd very much encourage people to join VHOGEN, because that's where you're going to get access to that information. Any organisation that is involved in our sector should be putting themselves forward for that. It's a supportive group and it will give you opportunities to learn. And one of the other points which I think is really important is particularly given for our organisations, most of us, or well, all of us, are covered by enterprise bargaining agreements. What role can we play to make sure those agreements, as employers, not just for the unions and employees to advocate for this, we need to do some of the heavy lifting to make sure that there are clauses in those agreements that enact a lot of what we've been saying. So, the role that we have to play in making sure that there's fair access to leave and all of those other things that if they're not in the enterprise agreement, it's very hard for you to swim against that particular river. And just any last closing comments that anybody wants to make before we finish?
If anybody wants more information, send us an email, contact us.
Absolutely.
I'd just like to say thank you very much. It was very exciting to hear the examples of what Sue and Chris are doing in their own organisations. And I can see my team going to be contacting both of you for some more case studies for our website. So thank you very much. Thanks for the opportunity.
Thank you, Niki. And it only remains for me to thank our three speakers, Dr. Sue Matthews, Dr. Niki Vincent and Chris McLoughlin, for their participation in this event. We're getting lots of good feedback through the chat. I think people have found this a very valuable, informative and hopefully inspiring session. We'll get in touch if they have questions and hopefully go back to their services inspired to do more to help us fix forever the scourge of gender inequality. If you weren't able to get your question through today or asked today or are seeking any further information, please contact us or the Commission for Gender Equality in the Public Sector. Niki and her team will be, I'm sure, very happy to hear from you. After the session, there'll be a short survey that will appear in your browser, in which you have the opportunity to let us know how you found the session and any other topics that might be of interest to you. But as we close, I'd like to say thank you to our speakers again, Sue, Niki and Chris. I'd also like to thank the VHA team and VHOGEN team members who've supported today's event. From the VHA, that's Joe, Julia and Hazel, and from VHOGEN, Sarah, who Chris talked about from the Alfred, and Monique from the Royal Women's Hospital. So thank you to them and to all of the other VHOGEN members for making this event happen. And thank you all for participating and asking your questions. And please take these messages back to your organisations, because without you, we will not be able to make the change. So thank you all and have a good rest of the day and a good weekend.
Thank you.